Hello, my name is Trey Hiles, and here's my 5P project. My passion is the lack of effective drug treatment services in Northern Kentucky for those who have substance use disorders. And so, passion for this is, um, in general, in the country, drugs are a pretty bad problem. Um, and specifically Kentucky as well, it's ranked really bad as far as overdose and just amount of people who use substances. There is, in just 2017, there were 1,500 Kentuckians that died from overdose, and largest increase were in the counties of Jefferson, Fayette, Kenton, and Campbell County. Along with overdose deaths, it was estimated about 500 billion was spent on, which was only 3% of the gross national product. And then I work at the Cabinet for Health and Family Services in Kenton County, and Kenton is one of the larger counties for overdose deaths. And I can see this because it's relevant because a lot of our cases are involved with substances. And this is an issue because impact of substance abuse on a family can cause relationship problems, stress, inability to control finances, employment problems, interaction with criminal justice system, and codependency. This presents a concern to our families due to children having a safe place to live while also finding permanency for them. To help these clients, we want to help them to become sober and engage in services to address their substance use. And Kentucky lacks in areas to providing substance abuse treatment as it falls below the national average in that number of behavioral health professionals for every 1,000 people with substance abuse. Along with lack of professionals, it was found in 2017 that Kentucky spent the least amount of the general fund on substance abuse agencies. And Kentucky is one of the highest states with opioid use, but also spends one of the fewest amounts on substance abuse programs. This creates a problem to those in need for substance abuse treatment. This is close to me as I have family members and friends that are used or have used and are still using. It's just very sad to see people who've been very smart, good looking, and it just sucks to see what drugs have done to them. And working with clients of the cabinet, I deal with a large population that are involved with substances. It is our job to provide services to these clients to help address their substance abuse issues. It's very sad to see clients not get the proper help they need as they're not effective services for them. I would just love to see clients have more opportunities to engage in services and become sober and get their children back if they do not have custody. So the idea aspect is identifies the stated position on this issue from Social Work Speaks is the NASW supports and advocates for policies that promote increased access to affordable services, including treatment coverage under healthcare reform requirements. Social Work Speaks also reports that there are barriers to treatment and that they could be caused by factors such as lack of available service provisions, lack of financial resources, unwillingness to engage in services, and social stigma. And it's also substance use disorders are also occupied with co-occurring disorders, more than one substance, or presence of other psychiatric disorders. Social Work Speaks reports that harm reduction approach is consistent with values of self-determination and meeting the client where they are. The described part is the ethical foundation is in the code of ethics is value of service. Value of service means workers should elevate their service to others above self-interest. Other states that workers should help people in need and address social problems. This is related to this topic because clients should be given effective treatment and to fight any barriers that stand in the way. Elaborate, some questions are, how can barriers be eliminated for those trying to get substance abuse treatment? How can you get the effective or the general population to understand substance use? And then what is the most effective substance use treatment? And then apply the lack of substance abuse and mental health treatment impacts this country as a whole, as there's a tremendous amount of people that have substance abuse issues. And the advantage in some states over Kentucky is other states have spend more money and they have increased research and things like that. And then the law was Comprehensive Addiction and Recovery Act, or CARA. It's SB or S524. It was introduced in 2/12/2015, became law on 7/22/2016. The sponsor was Senator Sheldon Whitehouse, and he was a Democrat. And basically, this law authorizes $181 million each year to increase prevention programs and availability of treatment programs. and it launched evidence-based opioid and heroin treatment programs that have proven to be successful. It has also expanded recovery support for those, and also an interesting thing that I saw in here is it also helps pregnant and postpartum women and their children, and created a pilot program for state substance abuse agencies to address any identified gaps in the continuum of care. And it also created monitor and tracks prescription drug diversions and to help at-risk individuals access services. And then the person I think that would be helpful is John Yarmouth, and he is from Louisville, Kentucky. He is the 3rd congressional district in the U.S. House of Representatives. He's a member of the Democratic Party. He went to Yale and got his degree in American Studies, and then went to Georgetown University where he got his law degree. Some major contributors to him were the Brown-Forman Group, American Crystal Sugar, American Optometric Association, as well as others. And he's a big advocate for children and families' access to healthcare, lowering the amount of substance use. He was a supporter of the Affordable Care Act. He voted in favor of the auto bailout, TARP, for the stimulus bill, and in favor of Opioid Crisis Response Act of 2018. Um, I wasn't able to interview him. He didn't reply to my email or my letter, but some questions I would ask him would be, how can the state of Kentucky address the substance use issue, and what are his thoughts on creating more evidence-based practices for substance use treatment centers? And he would be good with my topic because he voted yes for more funding to combat illicit narcotics and to reduce organized crime, as well as a stance that every citizen should have access to health care. And he also provided resources in Louisville to help reduce youth substance use. Um, and he is in favor of reducing the amount of substance use. He's an advocate for family and children. So he would want to help ensure that families and children are together whenever possible. And if increasing services to people who use substances would help, that would be what he would stand for. One agency I talked to was People Advocating Recovery. It's an agency that advocates including increased funding for treatment, restoration for voting rights to ex-felons, working for pretrial diversion programs, includes educated advocates that hold rallies and educate legislators about recovery and the importance of it. And then some of the answers that they did to my questions were, they said the opposite of addiction isn't sobriety, it is connection. They also said addiction is a chronic disease. It needs to be managed over time. Helping with the disease can assist with relationship improvement, decrease in disease progression, and underlying mental health issues. Many treatment centers are not evidence-based, and there are not national quality metrics in place. The disease is multifaceted and complex. The solution also needs to be multidimensional. It needs to be treated over the long term with evidence-based practices. Good marketing and rating systems of quality treatment centers will be more effective with sobriety. And then connect with workers in the space and share other social media advocacy posts and join them in the capital to help efforts is how they advocate for those with substance abuse issues. And the other agency that I interviewed was To Write Love on Her Arms. And this is an agency that was made from this guy who was a friend with his friend who struggled with mental health, addiction, suicide ideation, and self-harming. And it was when he shared on MySpace her story and when she went to treatment, and basically To Write Love on Her Arms is what he named it. And it was just basically spreading awareness about her and also raise money for her treatment. But To Write Love on Her Arms is a nonprofit movement dedicated to presenting hope and finding help for people struggling with depression, addiction, self-injury, and suicide. To Write Love on Her Arms exists to encourage, inform, inspire, and invest directly into treatment and recovery. And then some of the questions they answered were, they exist to present hope and find help for those who may be experiencing an addiction. They believe the best treatment would be utilizing licensed caregivers and overall caring for genuinely the people. To Write Love on Our Arms is built on advocating for those who are struggling, connecting them to professional help. This exists in the events we do connect with people on the road, the campaigns we host to fundraise for treatment and recovery scholarships, and the clothing we sell with reminders of the mission of the organization, which is how they advocate for people with substance use disorders. And overall, my general takeaway, my impact is it's not up to the amount of treatment centers, but the quality of them. My interview resulted in me learning that there need to be more effective centers and that are evidence based. There are multiple services that are in place for people, but they're not getting the job done and they're not evidence based, which can lead to people relapsing more often and frequently. And I also want to revisit the quote from my interview that I loved, which stands for the opposite of addiction isn't sobriety, it is connection, which helps people get support, helps people maintain their sobriety, and could potentially um, stop relapse from happening. And then also just overall caring for people and making sure people feel loved, and it will go a long way in making sure that people get the appropriate treatment by fighting this stigma people have against people that use substances and not believing that substance use disorders are are a disease. That's the biggest thing that I took away is people trying to need to first learn more about substance use disorders, what they are, understand it's a disease, and then fight the stigma, which will further increase funding, which the funding will also go to more research, will find evidence based that will be able to be implemented in um, services and agencies. And then here are my sources.